Hi, I am Dr. Sid and welcome to ScolioSmart NYC. Today I want to talk about one of the biggest challenges we face in scoliosis care, a condition known as Flatback Syndrome. Flatback Syndrome is a condition in which the mid-thoracic spine loses its natural backward curvature, also called thoracic kyphosis. When you look at the spine from the front, it should be straight. But when you look from the side, the spine should have three normal curves: a forward curve in the neck called the cervical lordosis, a backward curve in the mid-back called the thoracic kyphosis, and another forward curve in the lower back called the lumbar lordosis. These curves are what keep us strong, balanced, and flexible. Without them, we would stand upright like a telephone pole, able to resist gravity but unable to move freely. Many patients with scoliosis also develop some degree of flatback syndrome. When the thoracic curve is lost, it makes physically treating scoliosis far more difficult. In many cases, flatback syndrome must be addressed before a scoliosis curve can be properly corrected, and in other cases, both can be managed at the same time with coordinated treatment. Common symptoms of flatback syndrome include pain between the shoulder blades that does not improve with standard therapy, temporary relief from chiropractic care that quickly fades, increased pain when trying to extend or arch the back during physical therapy. Anything that forces the back to move into that flattened position tends to trigger pain. That normal thoracic curve actually develops in the womb. It is the first C-shaped curve we are born with before we learn to lift our heads, crawl, and eventually stand. If we lose that natural curve later in life, we also lose a large portion of our biomechanical function. Restoring that curvature is essential if we want to improve or stabilize any type of scoliosis. Flatback syndrome is also common in patients who have had spinal fusion surgery for scoliosis correction. In many of these cases, the thoracic curve was not properly restored before surgery, and as a result, the flattened spine causes chronic pain or hardware failure later on. This often leads to revision surgeries, which can be complicated and difficult to recover from. At ScolioSmart, we take flatback syndrome very seriously. We carefully identify whether a patient has or is at risk for developing it, since certain scoliosis curve patterns are more likely to cause flattening of the thoracic spine. If we find signs of flatback syndrome, we use specific corrective procedures and protocols designed to help restore the normal thoracic curve. These can be incorporated into your scoliosis care routine or completed before starting your main scoliosis treatment plan. I am Dr. Sid, and thank you for watching. Flatback syndrome is a complex and very real issue that can make scoliosis care more challenging, but when identified early and treated correctly, it can be managed successfully. At ScolioSmart Neurospine Care, our mission is to help patients understand the full picture of spinal health. Not just the curve you see on X-ray, but the whole spine, the whole body, and the whole person.